A recent announcement from the University of British Columbia will have an impact on our region. The Rural Family Medicine Residency Program is a 2-year program that sees student physicians from the university practicing across the province. Director for the program, Dr. Henry, feels that the rural program will help build students' confidence.
Well, I think when people are trained in the city, they're sometimes intimidated by the responsibilities of a rural practitioner. We have a mandated 8-week experience for every single resident. So our goal is that every resident can practice anywhere. But there's no doubt they're competent, but to be confident, I think, requires more long-term engagement with the sort of setting where you're going to be working. So what we're finding when we ask residents completing in our small rural programs, we are really noting their confidence to just, get started and practice the full spectrum of care.
Having the students training in the region will encourage them to stay in the area and hopefully ensure we have enough doctors to go around.
It's about a 16 to 18 more likely chance that someone will stay in a community and practice if they've trained there. So the hope is that what this can help us to do is to better bring new physicians to the community to practice, and hopefully to also keep them here because they'll be very comfortable in this setting.
The third-year medical students feel that the training they receive here will be more hands-on and give them a wider variety of skills.
Well, I grew up in Rossland, so I already knew that I liked the area and all the recreational opportunities and the community around here. And so I was really interested to come back and spend some time training here to see what it's like to actually practice medicine in a small community like this. And I'm really looking forward to being part of the interprofessional healthcare team and giving back to my home community.
We have this relationship with our teachers where they see us from the beginning of the year straight through to the end, and so we can get feedback as we go and build on the things that they've been teaching us, and they know what our level of understanding is, so we can kind of build on that each time we come in and have a session with them.
You get sort of a different kind of medical experience in our third year that's a little bit more integrated, and we get to work across different disciplines instead of just in a single discipline. So we get to see patients and follow them through their primary care and into the hospital, and then hopefully out of the hospital. We really get to see a cradle-to-grave approach to medicine, and that's a really unique experience that not a lot of third-year medical students at UBC get, and also in a wonderful community.
The program will officially start in July 2015. However, 4 students are currently already practicing in the area, and not only are they enjoying the training, but also the many amenities the Kootenays have to offer. For Go Kootenays in Trail, I'm Jennifer Waldy.